Hello and welcome to Hallway Healthcare again. Today I'm going to show you how to complete the new Soapie form. So first, of course, you're always going to make sure that you're at hallway.devero.com, and then you're going to type in your login. And just a reminder, if you ever get kicked out, as you can see right over here under announcements, if you get logged out and need help, please call this 1-800 number and press option number 1. So I'm going to log in, and now I'm going to come up here and I'm going to select my patient as I always do, but I'm going to go on to test patient. Okay, so just like I would for my regular shift as before, we're still going to complete a skilled nurse visit note. So I'm going to click that, open it up, complete it as I usually would. And now I'm going to go to my first Soapie note for the day. So I click Soapie. I'm going to come, put my time in, time out. So this is my first note. So I'm going to say it's 7 a.m. to 9 a.m. My subjective data, my patient has lung cancer, and over this 2-hour period, he was complaining of being short of breath. So I'm going to say, patient complains, I am really short of breath today. So now, instead of actually clicking the box, because as you can see, when I click this box, I can't get into it. So now what I have to do is actually click eligibility to find out what care plans I can choose from to wrap up my care plan for this note. So I clicked eligibility. There's already been 3 care plans, these 3 care plans selected for this patient. And I could actually choose ineffective breathing pattern, but I'm going to go ahead and say that based on my assessment, I'm going to choose impaired gas exchange, because when my patient was complaining of being short of breath, he was actually, and I checked and assessed his oxygen saturations were 87%. So that is more impaired gas exchange than ineffective breathing pattern. So then I would click insert from template. Then I click select the category. And now I'm going to scroll down until I find impaired gas exchange. Right there it is. Impaired gas exchange objective data. And I click it. And as you can see, it has all the information of what impaired gas exchange would be for any patient. So there's only one, but I'm going to go ahead and select right here. Now that automatically selects it to insert it. So you can click here and it selects them all, or you can just click one, which for this one there is only one. So insert template to eligibility. Okay, now I'm going to come to the box right here under eligibility, and I'm going to double click it. As you can see, it's now highlighted all blue. And basically what this is for is when, if you don't like any of this, you want to put your own objective data, then all you have to hit right here, because it's already highlighted completely for you, delete. But of course I don't want to delete that, so for me personally, I just want to delete what doesn't apply to my patient currently. So right now what does not apply is I did not check his arterial blood gases. I'm not in the hospital. Didn't check for that. He did have abnormal breathing rate, depth, and pattern. I'm going to elaborate a little bit more personally. I'm going to say his rate was 24 breaths per minute, uneven, and labored. Okay, did he have confusion? Not this time, he didn't. Cyanosis, he's not a neonatal, so no. Decreased carbon dioxide, I don't know that because I didn't draw labs on him. Was he diaphoretic? No. Was he dyspneic? Yes, he was. Did he have an elevated blood pressure? Well, if he did, I would definitely need to put that here. And in this case, he did. It was 153/92. Headache upon awakening. He didn't complain of that to me. I don't know if he has high carbon dioxide. He wasn't really hypoxic. Hypoxemia, the same thing. He was irritable. He did have nasal flaring. He was paler. He did have restlessness. No, he wasn't lethargic. Tachycardia. If this is the case, go ahead and put your rate and say what it was. So he was tachycardia at 110 heart rate. I also probably should put blood pressure after this. Did he have visual disturbances? No. Okay. And then, of course, any other objective data I would like to add, I can. So that actually just kicked me out faster than I wanted to. So to go back into it, just double click the box again. And then, as you can see, it still highlights blue. And all I have to do to get it from stop highlighting blue, I just click it, as I did. So now, oh, it's doing that every time I hit enter. Okay. So now if there's anything else I'd like to add, I can absolutely add right here, like unsteady gait, noted shortness of breath at rest, whatever you'd like to also add. Okay, so now I'm done, and I'm ready for this to get inserted. So insert to form. So right there, as you can see, it just added all the information. So now I need to go to my nursing diagnosis. And again, I just selected impaired gas exchange objective data. So of course, what do you think my nursing diagnosis is going to be? Same thing. I'm going to stay within that category because I just got done saying impaired gas exchange objective data. So I'm not going to come here and say my nursing diagnosis based on a desaturation. Oh, which brings me, I need to go back to it and add that. So we will do that. I need to put in there his O2 saturation. But again, I wouldn't come in here and add a nursing diagnosis of chronic pain or caregiver role strain or activity intolerance. That makes no sense when I'm just got done saying all my signs and symptoms are impaired gas exchange. So again, that's going to be my nursing diagnosis. It all will flow. So impaired gas exchange nursing diagnosis is what I select. And as you can see, this has a lot of information. So I'm going to select it, insert to template, and then I'm going to come to the box and I'm going to double click the box because now, and as you can see, it's highlighted blue. And again, you can delete all this, rewrite it if you want. For me personally, I'm just going to delete what doesn't apply to my patient. So now I've just got to click the box again, and now I see my blinking cursor. Now I can start deleting what I don't want. Related factors, you honestly only need about two to three. I don't need all this. So especially all these diagnoses, my patient isn't a quadriplegic, multiple sclerosis, none of that. So I'm honestly just going to go through here and delete what doesn't really apply to him. And I only need about two. So I'm going to, because I just got done saying the main reason is because his oxygen saturations was 87%. So I'm just deleting all that and leaving altered oxygen supply, altered oxygen carrying capacity of blood. There you go. And I can even add O2 stat, or, that would actually go in my evidence, as evidenced by. And you can see this is a duplicate. So I'm just going to come right here with my cursor, highlight this, delete it, because my objective is O2 sat, saturation, 87%. And then, of course, it's always good to say if that's on room air or if they actually have oxygen and what the liter is. Secondary to accepted disease process, choose all diagnosis, apply listed below. So again, my patient has lung cancer. I'm going to say the lung cancer. All right. So now I'm done with this. And I say insert to form. But remember, I said, oh, I forgot to add the oxygen saturation. So now I need to go back into eligibility. Okay, it wasn't under chronic pain, impaired gas exchange. So I click impaired gas exchange. This is what's in there currently. Double click the box. Click it again, come to the end. Now I'm going to say O2 saturation, 87% on room air. Okay. Then insert the form. As you can see, now it's there. All right. Now I'm going to go to my goal. And again, we're going to insert from template, because impaired gas exchange obviously is not an option here. And again, I'm not going to choose a goal of activity intolerance or chronic pain. I'm going to be flowing and match exactly what my care plan already is, which is impaired gas exchange. And I select the goal, insert template to goal. Double click. And as you can see, now it's kind of separating. Here's several goals. I really don't need all of these goals all at once. So for me personally, I'm going to go ahead and delete some of these goals because I really just need one. And my main goal is optimal gas exchange. So now we're going to say insert to form. And now I'm clicking interventions to select my interventions. So I go to insert from template, select the category, go scroll down till I get impaired gas exchange. And here I will select all of them. As you can see, I selected text, which does select all of these interventions. And I say insert to template. So that way when I come back to this, I can choose which one I want to actually go to my Soapie note. So I don't have to go back into this. So now I'm going to double click interventions to unselect them all, because I definitely don't want to be adding over 20 different interventions to my one Soapie note. I just want to pick about 2 to 3 of these. And usually you're always doing some type of assessment. So I definitely want to say that I assessed his respiratory rate and depth and his effort and his nasal flaring, because I absolutely did. Then I want to say that I considered positioning of patient prone. That's a good one. Actually, I like this one better. Encourage slow, deep breathing, use an incentive spirometer. Okay, yep, I did do that. And then I also educated on pursed lip breathing. So now I'm just going down here trying to find that. Okay, here we go. Here it is. And of course, if there's ever any of these words that you don't like I don't care for the word help. I like to say assisted and instructed. And there you go. And so now, and then to get out of that, you can just click anywhere else. And it accidentally selected a box for me. Okay. So those are the 3 interventions I chose. And then I say insert to form. All right, they're all there. And evaluation. How did my patient respond to my interventions? Well, after, because remember, my goal was after 12-20 minutes, right? So after 15 minutes, patient's respirations decreased to 18 breaths per minute. Excuse me for a second. Okay. Even and unlabored. O2 saturation increased to 95% on room air. Patient demonstrated understanding of skilled nursing instructions of deep breathing exercises. I'm not the best speller. Exercises. No. Okay, that's totally wrong. There. Okay. All right. And I really should have said that in front of this. Okay. So there we go. There's my evaluation. Now, I'm done with this note, and I'm ready to say sign and save. Okay, let's go to another Soapie note. Okay, so now this is 9 a.m. 9 a.m. to 11 a.m. Okay, so because my patient has lung cancer, this is an ongoing problem of him complaining of feeling short of breath. So I'm going to do it again. Patient states, I can't breathe. Or instead of even saying states, I mean, because like during this time you can say, patient yells, I can't breathe. Okay, so during my assessment, his oxygen saturation at this time was 84%. So as you can see, these care plans, chronic pain objective data, decreased cardiac output, impaired gas exchange, ineffective breathing pattern. So I could choose these others, but truly when their oxygen saturations are down, the correct care plan is impaired gas exchange. And since I've already selected it before, I can go to it again. And right here it is. So I'm going to select it, but I'm going to double click the box and add the correct objective data now. Because of course my objective data should always change. So now we can say he had 28 breaths per minute. He was uneven. Let's see. During this time, I didn't check his blood pressure, so I'm going to delete that. And he's restless, tachycardia. It was 108. Steady gait, yes. O2 saturation, 84% on room air. Okay. Now, but let's say that you want to be able to see all of those objective data, because if you remember, we deleted quite a bit before. So if I want to see all of that, then all I need to go is to insert from template, go back to impaired gas exchange, and right there is all of them. And I can say insert to template, and it's just going to double it, right? But here's the one that I just did. Here's the one that has all of them in there. So all I would do is just unselect that and keep mine. But compare to see, is there any other symptoms that I would like to add to mine, such as confusion? Was he confused this time? He was? Okay, let me add that. Confusion. Was he cyanotic? No. I already kept dyspneic, elevated blood pressure, headache. He didn't have that. Okay, so everything else I still have in here. Nothing else I'd like to add. Okay, insert to form. Okay, prognosis, that will be the same. Do I want to change my related factors? No, but let's say I still want to see what all related factors there are. See if there's any I'd like to add or maybe change. So I'm going to insert it again. So right there it is, and it's already pre-selected for me. So I am going to unselect it. This one's mine that I chose. Is there any other related factors in here? No, he doesn't smoke. Related to immobility? No. An infective cough due to head trauma? No. Okay, so I still like what I kept because his is more to lung cancer. Okay, but I do need to change his oxygen saturations because that did change, obviously. That was 84% now. Okay, so that's my diagnosis. I say insert to form. There it goes. my goals. So my goals, if you remember, I deleted several of those other goals. So I definitely want to come back and I want more options of what goals I can choose from. So I'm going to go to impaired gas exchange. I'm going to select those goals. And now I am actually going to double click this. I do want his gas exchange to come back up, but this time we're going to verbalize understanding of oxygen. Yes, because I administered oxygen this time. Okay, so I'm going to delete these other goals. Okay, and so now I have 2 goals instead of 1. So now I'm going to insert that form, interventions, and now I go to impaired gas exchange, and now choose all the interventions that I did. And again, just try to keep it to about 2 to 3. But here's the beautiful thing. Now I can choose different ones that are applicable to him. Okay, so I can say that, yes, this time I assessed his lungs to check for any crackles or wheezes because now he's decided on me twice. Administer prescribed medications. Absolutely, I did do that. And right here, I administered my oxygen. There's my 3 diagnoses. Bam. Scroll down to the bottom, insert to form. Great, great, great. Okay, and now I put my evaluation. Okay, so I will say, assessment completed. No adventitious sounds noted, such as crackles, bronchi, or wheezes. So, because again, I tried to address every intervention because I said that I assessed his lungs, so I need to put in my evaluation, what were they? Noted diminished breath sounds to right lower lobe. Let's see, and then we administered his rescue inhaler, and so effective response to albuterol inhaler and oxygen therapy by respiration decreased to 19 breaths per minute, even in unlabored. O2 saturation increased to 94%, or no, that should be more like 98% with O2 at 2 liters. 2 liters per minute. Okay. All right, so there's my evaluation. I'm done with this note. Great. Sign and save. So again, we'll go back in. We'll do one more Soapie note. All right. So now it is 11 a.m. to 1 p.m. This is during my lunchtime. And so usually during lunchtime, what are you usually doing? You're usually getting them lunch and you're administering any new medications. So here we go. Patient states, what am I taking again? All right. So eligibility. I want to definitely document about his medications because this is a time when I administer my medications, which is my highest skill or one of my high skill nursing interventions. So I'm going to go down here to find the objective data with that. There we go. Ineffective management therapeutic regimen. All right. So insert to template. Okay. Just daily living. And again, I'm going to double click the box. And I guess you could even say triple click. You double click to go into, and then you click it again so it doesn't delete it all. Choices of daily living, effective goals, treatment or prescription increased illness. What's our to manage or less difficulty with prescribed medication? Yes, or less by patient that he or she did not follow prescribed medication regimen. So this one doesn't apply to him because I'm his nurse and I am administering. He's not. So that one doesn't apply. Okay, so the others do. So now I say insert to form. There you go. Prognosis. Again, I would not choose decreased cardiac output or chronic pain because I'm talking about medication here. So I scroll down, find the nursing diagnosis that I'm talking about. Then I come here, I double click the box, click it again, and now I'm going to delete what related factors do not apply to him. Complexity of healthcare, yes, absolutely. Complexity of therapeutic regimen, yep. Decision conflict, no, he doesn't have that. Excessive demands made, no. Family conflict, no. None of this applies. Adequate number and type of cues, actions, knowledge deficit. Yeah, he does have knowledge deficit. Perceived seriously, no. Okay. So now I'm deleting all of this. So there's my related factors. Okay, as evidenced by unable to verbalize medication regimen. Okay, secondary to accepted condition. So which condition are we talking about? Lung cancer. Okay, now insert to form. All right, so what's my goals for him? So again, let me go to the nursing diagnosis and effective management of medication. Select my goal. Okay, there is only 2 goals here, and actually 3. Identify appropriate resources. Okay, so this one is not applicable to him. Okay, so yes, I'm going to have both those goals. Interventions, insert from template, select the category. My category is obviously the nursing care plan I'm talking about. Currently, I will, during this time, select again the checkbox of it all. So that way when I come back to it again down the road, I can just choose which ones apply. So when you're here, you want to select them all. Insert template to interventions. Okay. And again, you can see all of these are checked. I don't want to add all of those to my Soapie note. So I'm going to just click that again, and now it unhighlights all of them. Now I will come in here and mark which interventions I did. Well, number 1, I administered the medications that he needed. And I assessed the monitor for adverse effects, absolutely. And then I also did some education. So educate patient on the benefits of adherence, absolutely. So here's my 3 main ones. Insert to form, okay. So now evaluation. Patient requires ongoing instructions of medication due to inability to verbalize current medication regimen or purpose of medication. And no adverse effects or side effects noted at this time, because of course I just gave this to him, so there's still time for him to have an adverse effect or side effect to the medication, but noted at this time to medications administered. Okay, and then here, of course, it might even be good, you could even go into more detail of everything that you administered that was related to lung cancer, such as his nebulizers or inhaler, and more of his response. So I'm going to go ahead and say sign and save. And now I'm done for the day. So now I'm scrolling down to my pending of what I just worked on. And again, after you get done, you just open up these forms, double click, look at them again. And if you realize anything that you forgot, for instance, all of a sudden you forgot to put the diagnosis, again, all you have to do, click the prognosis, go into the care plan, and then double click the box, click it again so it doesn't delete all on you, and then fix it. And then go to insert to form. I'm going to hit cancel. Okay, but this note's good for me. Send to the office with my signature, absolutely. Okay, that one's done. Good, good, good. Send to the office. And please note, when you do double check your notes, please make sure you are actually double checking and that you have actually read what you put. Because sometimes it has been noted that it's obvious that the nurse didn't even actually read what she was writing. Okay. And that's the end of this video.